Honorable Majo.
Nana mpacho mi jiwoso.
Maybe aboko there.
Nyame adom.
And so why for opposition and why for that?
Oh, adom na ye juma.
The favor of God
adom kuti.
Remember me also nya grace no nya adom na nya yi.
Adom no.
Ana oma mo ayesi wo ho.
Oh, say first of all, I'm in chia oti for nyina. Me who die sebi eha ye nyamu end this for no ma wanya to me no. Instead of the focus or me focus ahwe de ometima ye ayama Ghana for no. De bia no munam e ko fan sem biesi. Omu fan sem ombezo mu creative pressure say sebi o Ghana ya na ye hwe Ghana so no na ye boniyefo to say ya nye adwuma. Meanwhile no ye adwuma no the people experienced it.
Yeah.
Obiana Okoe hospital Okoe tenancy 5-6 hours etwen folder. Okoe hospital 5 o'clock. Na ya catch say yeah hwehwe folder. Ye be wo folder na say gino na ya bo 1 2. After na call doctor. Sa nipa na Akufo Addo ni MPP bat power. Omo nsa fe de Okoe hospital ye bo odin any unama papa no na ye see ko doctor. They've seen the value we brought. Untimi mfa ebi mekanwa. Muso na makofa asema but say de BBC. Enti yenua akando ni sebi ni kasa odinam say ena he inherited a mess eba light wave health no.
Yeah.
Eno na asema brofo beka say a serious fabrication.
Busrem some kind of.
Oh, ni kasa ni bebre no. Fabrication, serious falsehood, misrepresentation. Just say, I didn't know you koko na wa dane no. Aye no tuntum
to paint MPP.
Yes, black. Enti what can say bebre? I mean maybe a free.
Right. Nyabotrana walk us through 2019 contract money light wave have information management system mo entire no na ho hye e te say dey dwuma poten na eso mo ye edema health ministry no.
I was saying my background kakra.
Okay.
You see, e-health projector. The HR say a projector MPP are buying the buyer. Emma hospital say what Ghana nyina. Ye niama to say 34 na mu tro nipa di wo krata so a ye di share store room. But oba ye be bo within wo computer so. Ohun sem nyina wo computer so. Uko hu doctor ye mfa krata ma obedru doctor no bo within pe na wa hu de wo kan ye.
Okay.
Doctor no so trade roma wa umfa elma wo krata fa nko pharmacy obedru pharmacy ye bo na ma pe na wo ndro wo oji wodru a pa okofi na ade ba ko so ema health no MPP abandi ba ye bo aye say obi a Okoe hospital Winiba na una ebu na edru na Winiba for say we de mu ye din na mo mfa no nko kolebu a say ye type u ni ama wo Winiba obedru kolebu a ye mbisa wo say folder wo hi sa na ma na wo isu Winiba na eno aye bo kolebu pe Emma Winiba insem na etro nyina epie wo krata we computer so. Enti profo say networking. Sebi obi su enam na obi piano to form na ye nim ni history. Na ye hospital na ye boni dim per system ni timi kire say oh asima say we there oti bojo asina ni records ni. Enti dia na abaya aba ko nyina obi an ni kukudro de be e na sebi ade e first na ye den e
sikane ye. Yeah.
Enti a projector na hospitals anko na omo di omo sika koto system a ebe ma omo aye niama o computer so.
Okay.
But we the MPP aban Akufo Addo aban fa etu no say on obetua sika no from government ama ya ma all hospitals free.
Na ye universal.
Yes, na ye ma ye FM afi the private hospitals. Me minister no ehia me srem say doctor say na mo years say uko government hospital ye kita krata bibia akọ kama na esrebo mumfa yen kan na yesu ehwe Ghana for even the private sector started pay cho say inform kan na denti na we ba aba in fact before me koso ma me kite for say e-health project no started under NDC.
Okay.
Company na ye na ene account of poor bi for their money nti onama o kasa ti so omu yen krofo a omu nya Ghana for ena omu ye boniyefo ena omu for data 7 company no under NDC na start ejuma. Omu first ejuma omu ye omu sign contract 1st April 2016 between Ministry of Health and Lightwave E-Healthcare Solutions Limited. First contract April 1st April 2016.
ana bunya butama me afa no adwane ye na me pacho hana Ghana tie ha na ese utie hana abeti nsem ni nyina free press conference health minister honorable Minta Kando ekoye ye no emu nsem ni start dig no and Dr. Bernard Okoe former health minister na ye no edin komo was say NDC pencil 2016 April and as a light wave hair for no Ghana and you are more contract mu.
Yes.
And in 2019 as stated by Dr. Minta Akando.
Yes. Now, the Minister for Health, brother, Segbefia, Honorable Segbefia, no Minister for Health. And first, I'm friend of phase 1. The NIA started with NDC, I'm resting. Now, digitizing and networking 25 hospitals in the central region.
Only central region?
Only central region, 25.
Okay.
Including Cape Coast Teaching Hospital. 25 no omu ye no omu de ho krata be kire MPP ba aban 2017 omu be kire Minister for Health say o minister ye nim say aban asisa nanso ya ye free light wave ye Ghana fo a ye kita nim die srunko ye betimi ama Ghana nyina ye be jai krata use ba ya sha se wo Cape Coast any central region munhwe adwuma ya ye ena adwuma menu di kasa we ko kire cabinet ena ekufado cabinet say hey solution we no enye se obi be ka say sha si NDC mrensu to ne ntuntwiri enti ye be national rollout because first 25 no was like a pilot say oh ya sha say de no meka no metimi ayden ayana eti in 2018 and I started discussions on the national rollout the cost amount be costing yama now in July 2018 PPA approved Ministry of Health request for the contract for the national rollout. The PPA approved at a cost of $186.7 million. 186 for the whole Ghana.
186
to digitize 950 health facilities. Now, 2019, PPA approved a still no because MPP are buying a pay value for money. And yes, no one has signed here. Yeah, the request no sir, call Ministry of Finance. When I PP, the Omudi Ministry of Health call Finance, and the Ministry of Finance the man Omu department the from value for money audit team.
Okay.
Omu na the contract, but Omu say contract way the air cano sika edi man enu na ya na, and as our team no, reduce the amount from 186 to $100 million. And the Ministry of Finance say, "You should $100 million." I was saying to me, "Enye juma."
That means I buy no cry idea so what me
no na me cano so that Nkofo won say you the processes to get value for money. Now $100 million, you know, it finally, and I signed a contract with Lightwave in 2019, and the date was I'll get you the specific date. Now was only 3 years. No. Croa. Yeah, born before computer. Nurses, udi wa folder so. The whole record unit. Ebi a computer crown type either. Obiaba all done all this hospital from village to Accra, ni Kumasi to Sola to Tamale to Pont to from place nyano. Enye Juma Sebi eda form. And the timelines I did my contractor. Yes, only 3 years. But by the third year, you say, oh, here more time. And the MPP administration extended the work, you know. For I think about 24 months. Emma, it was said by December 2024. Now I tell me aye jumani nyina. Now the one is say by 2024 ansa na ye fi abamu no. Reconciliation ye di vendor no Lightwave tenants ye kire say. Na MPP aban atimi I invest into Okoe hospital na unsala na enye no kwa. MPP aban tua an amount of $76 million. Edima Lightwave company no. And no nobody talk computers, switches, laptops, desktops, and servers. Niyama ye yusu a ebe nyina ye tuaye. But ye reconciliation no, and a reconciliation ni kire say. Sika na ye dey ama Lightwave ene ejuma wa ye no. Ejuma no match $66 million. 76 no kita no 10 million bi wo mu a eno no e ka ejuma na o ye no cheze Uya auditor, ye free on the wire ni de na match about 66. But certificates or the bani sky releases no reconciliation they see ultimate utia obi but chiro be the krata won say matua we krata won ba nanso juma wa wire no and drew amount na matua no and a Lightwave can say 10 million extra no in contract terms your friend no advance certificate o the scammer no na ejuma no yen we still ye na enu ejuma no has not happened. Still no or network hospitals
or ongoing project.
Exactly, ongoing. Enti as at the time me free ho no understanding ni say all the ejuma no be cover $100 million. Na kai say the project was worth $100 million. Ghana ntua 100 ni nyina. And this about $1.
Asuma twa $77 million.
Exactly. And 77 no one network 450. I can't 500. But you know what is interesting? We share only the figures and you get lost.
When I come here, say
yes.
Obi tincho baby say Juma will be worth $100 million. Now what me twa na $77 million. One network 950. Now why only 450? That means a half of crano will new papa near Beman $77 million.
It's good. Now we share only the figures. Obeka say oh undo half. But say we share the workload. Ejuma do the also yena. Wabu over 80%.
Juma is networking, no?
Yes.
Facilities are holding.
Yes. Na mechirem.
Hey.
Yedi ade no ma won no. Na enim say health centers, hospitals in kitikiti no mo workers endru 20 no. Omo ye close to 600 out of the 950. Enti contractor bi obeso onye smart no. Obeko form as start ye ebia Ghana for ko 100 a year. Enti ye share contractor ni say MPP aba share say free esro teaching hospitals. Kolebuni comfort no chepe almost staff strength ni patients e fa ho no e match 500 facilities na ka no.
Of course.
Enti although 500 no omo workload odi ni nyina abomu a is equivalent to say one network just comfort no che ni G kolebuni G. Enti contractor ni share da and all year they dey no first.
That is the Canada
within 6 months to 1 year these 500 all will go. Enti workload need here wa ye 70 to 80%. But who share just numbers are the who share no omo adwuma no wo form eho Okoe health center bi wo Kumbungu a staff ewo no omo do 7 nurse mienu ni attendance 3 omo ye 7 patients ever all the whole year do 100. Enti ye ka chere say men call those places we ka chere say why 700 chassis free through. Enti ye kasa a light wave wa digitizing all teaching hospitals, wa digitizing all polyclinics,
all teaching hospitals
in Ghana, all polyclinics, all district hospitals. I have the numbers.
Right, my figures, you know. But talking about Dr. Bernard Okoe,
yes.
Former health minister, and AD and Komo, and then AsaasePa 107.3. Jandamwa, Honorable Minta, Kwabena Minta Kando, Wabe, no, and a watching.
As we speak, the number of how do we call it facilities now saying 4 teaching hospitals, 950 no breakdown no 4 teaching hospitals, 6 regional hospitals, 243 district hospitals, 2 psychiatric hospitals, 49 polyclinics, and 646 health centers. When the workload now was on you know.
Send the idea woman there and one was.
And I clear 4 teaching hospitals, no. We clear 6 regional hospitals. We clear 243 district hospitals. We clear 2 psychiatric hospitals. We have 49 polyclinics now. I'm out of the 646 health centers. I have small hospitals, no. We have 157. I can't 489. And here out of the 489, no, you are about 100 to 200. I am mapping that. Just say almost that juma. The akari say call live. Live just say odruwa. A machine juma. But before you go live just say udemua who use computer no. E was say funny amanya den into form 200 150 to 200. Omo di nyama to form. Enti when your company awakoda o. Company aye kasa ni staff juma form. Open a yi no dia ma obi a open nti no obe gina se den na wo ka company we no foreign owned. I am saying on your show on authority say sa claim by honorable Kanda no it's a big lie.
And your foreign
the company was registered in 2015. It's wholly owned by a Ghanaian. The company has about 150 workers. Only Ghanaians. Not even 1% any foreigners. Na mobo ya say obi pe obi adwuma jinti. Otomi catch Ghana. Now your minister that will catch say company be a foreign owner. Unim unse uchan trobi na achieve fidi ananya say meet the press and a journalist back and say if the company is foreign owned then it should have gone to parliament for approval because our law said that before you engage a foreign company after the honorable account now say it didn't need to go to parliament. It's because on him say the company is foreign owned, how do you call it? Is wholly Ghanaian owned, and the workers over 150 Ghanaian IT experts, they are all Ghana for. Number 2, ono ba kando aba kache Ghana nyina say company no de data no ni nyina wo India.
Yeah.
Me ma for the first time education say e-health project no it was decentralized. The HN say uko Kofanoche. Data wo Kofanoche nyina e wo health so no e wo server so e wo Kofanoche hospital.
Enti ni baby ya.
Any baby ya.
Hey.
Uba Kolebu data nyina wo server so wo Kolebu. But because ni nyina ya Ghana dia no the whole Ghana obi data no ye the FNU central hub.
Yeah.
Backup, remote backup. Obi dia wo sa sem to a ubeba. Enu ni mebi e wo.
Dabi.
Ministry of Health dan no ebi anami wo no. Akanda was 7th floor on an office wo. Server na ekita Ghana data ni nyina e wo first floor e wo Ministry of Health.
Server ni India.
Me see I was first floor e wo Ministry of Health. Ansa na ye see Ministry of Health no na ni nyina wo National Health Insurance Data Center e wo NHIS office. Na onim or kanyama sebi I said you mean nim the or kanyama ye nim e bi okofa onim say before be be no pedestrian talk there's a kasa nkofo ka about
kwan ho kasa
omo nim IT mo meka che say companies omo ye reputable omo for mo adwuma ndi agro no say or handle adwuma to say the whole Ghana data onye ni such that say BBC or Ghana na data nyina ayira. They normally have what they call offshore support. And all international big firms uko Ecobank, uko Zenith Bank, uko how do you call it Barclays, BBC or Ghana na about to say data nyina ayira. Enu nche say company ni better form. Omo di omo yejuma no. Omo support at other places in the world.
Okay.
Enu nche say ona do data at all. But I say backup so that baby say sabotage bi chow nyama mo Ghana ha.
Ubetumi enya retrieve information bi.
Exactly. Now because of lack of knowledge in IT no. Ebi mu wo ministry ni T say oh we mu no mo offshore support in certain country. Oh your data ni nyina wa. Meanwhile account was 7th floor. Or first steps come from first floor of Ministry of Health. Data no Ghana data no nyina wo. Na wa be tran Ghana nyina say your data no wo India. Na the me yani say oh a whole minister high level or public official. Nyama wo ka nyina I can't provide you 1 page of evidence. And ka wo kan no when you krata data description in here from an IT expert. When nyina e wo India unkasa. Oh, can we or you when you na on bastardize company na yejuma no. Na on timen jina so on ji omo ejuma no. Na onim the esre.
Dabi.
Company no ye man extension the contract AWA 2024. TO. The amount problems we have say company no e try say approach Ministry of Health. Say the omo ejuma da and the information.
Month by in 2024.
Oh, December. As in ended with the year.
Okay.
And you started this year no. As apart from infrastructure, one provides servers, computers, any digitization, or training staff. They've trained over 150,000 health workers across Ghana. Lightwave. Training one year over 8 years. Apart from all this, no, provided the FN support service.
Okay.
Because they are the originators of the system. No? So let's say Confanoche, so like I said, Confanoche data you now almost serve us. Now so Lightwave at me accessing remotely. Say now Ministry of Health one. Say the omo yejuma. And the Confanoche nya problem. Now omo IT officers into me ya. Said omu data no network connectivity no internet ejuma Lightwave from the distance can enter and help them restore.
Okay.
And we support service. Now maka about the normal system. And the uko ebi se Cape Coast City Hospital. Ya kasa na omu the Lightwave na ejuma mo nya any problem. System bi an call down is because omu data nyina wo omu server no so. And our IT strength no air strong because they are the first. Who's the make first face? First, so they know the system very well. Now, Lightwave, apart from this support service, because our program and our system is very, very efficient, will say, first, now health insurance. You cry new program, you top software. Be boama yatimi anya claims. Sikado do benya from mom use health insurance. You use ya system and validate Oba hospital. Obeje dey say Lightwave to me share say almost system to me here we na. So Lightwave here bro for integration.
Okay.
Apart from so omo medical records for hospital no, omo to me boa national health insurance. And my health insurance the omo system no connect Lightwave. And my Lightwave to me omo data on nipa do omo the insurance e ba hospital.
And you paid for.
And you paid for. These were additional services Lightwave now providing integrations and contract no.
Now when you na minta kind of person.
Oh yes. And I make say mature piece be I'll release it this evening. What is happening is just a case of give the dog a bad name so you can hang it. Apart from national health insurance, most of the hospitals now omo software connecting bank accounts in the banks to the system no more used to, because say Lightwave ambassador ebe connect wu kolebu to bank need the say manage your patients now I say what show anyway
information here anyway
exactly.
Okay,
but Lightwave system because of developers you're very very intelligent to be chair hospitals say you bet me about this additional integration we hear so to biom to another software company obi a wahwe no obi hu sika obi wi akra obi hu we kra boa ma ebi say kolebu omo revenue cost 30%. Point am pese me ye ni say ye enter 2024 Lightwave for catch account say minister your contract in EU we have to network 500 more facilities. In addition ye mau this integration support no so ya mutu ya bibi kakra, but once we don't have a contract now say your cost we say we have no basis to make a claim and no be say no about kind of say can we do some paperwork nana tinti
o so ntia se
na omumfa access code emano
obi adwuma na obi company no a wo run no na fa access code ma no
na the ni say omu catch you say if Okosu say omu over 150 workers they cannot continue to pay them when you are not ready to even look at contract extension. Say person obe continue with the contract but person won twem kra ye wo kwan ye fa so aye den ye twem so that obi a ho nye enchire no Ghana ho enchire no na the issue ni say na ministry no person can continue with the support and at a point no omo jai support no omo jai enti na Okoe hospital omeka say BA system na ye den enye adwuma
because national insurance director say a technical problem now
exactly enti media ni say insurance crowd omo nya hwe account of behavior and orientation and ama company say well who say wonim the oil dia ene ekoso na area
shut down your system no
now who say shut down ene so omo shut it down unse system no say na make no hospital bia no the Lightwave building ma no one awurani but unya problem na o fair dia yentimi ma so
enti anya Lightwave for na shut down system
and na me say no so another falsehood as we speak many hospitals are using Lightwave, few had challenges but many in fact most of the people are now say it had nothing to do with system, it had to do with the integration. They say they are connected to a national insurance. Say no, any part of the contract.
Yeah. Just a support.
Exactly. Use knowledge of the system to provide an extra service to national insurance. And also they say invoice scan for that. See if there is no paper to support that, we are also going to sleep. Now, who minister now? One for pasu and for more engaging to make sure say we be seen. Ube jinawa bedroom dia ukani ya side of the story. And omuye saboteurs, omuye blackmail. Meanwhile, if I were the Minister of Health, this would not be happening because and you know what? In all the conversation, there is a paragraph in the clause in the contract, clause 28.1 and 2. It talks about dispute resolution.
Okay.
Now, because ye nipano, actually say if within 28 days the two parties, that's Ministry of Health and Lightwave, are unable to resolve a dispute, they must engage a third party. Nana, why do you mention third party? It's the rules of natural justice.
Yeah.
It cannot be the case, say, who Ministry of Health, do your business. Now say, you disagree on Bibia. Who minister don't determine how we should handle it. Because you are also a party like me. Honorable Kando Refi say, when it comes to party contract matters, nobody is more powerful than the other. I drew on the Ministry of Health and it's a minister over to me. But what can't also to me in Lightwave na ye pet. Because more apam say mo ye juma.
Yeah, until one will know portfolio assembly.
Exactly. Enti na contract na che say mo ntimi kasa wo kwan paso ntimi agree a mo invite a third party.
Okay.
Now third party no ye form of what? Mediation. And na clause na che say me nyina wo ha me contract no say mediation na ntimi ajuma then you move on to adjudication. Adjudication che say court.
Yeah.
Yeah, cause I account of fufu nyina no onko court o onko third party. Onwa than who party in the contract, complainant of issues, judge of issues, and then final executor of issues. Now the IS crane say uba no company ni some person mfa wontenase na wo ejuma de ekoso. Ye won ajimamenu won no mo hia ajimamenu na ye obi be a steering committee as part of this Lightwave. Minister Timubi, IT officers or Ministry of Health Timubi. IT officers Ghana Health Service team be all teaching hospitals IT team be na dey be omo monitor say na ejuma no ko na account of buy no meeting for almost 1 year.
Almost 1 year.
Not one meeting. On for beyond nasi.
That means onim de ekoso kra wo.
Enti niam na oka enti na niam nyina na nchen no. Enti na osi company no your foreign owned. It's a lie. Data or India. Data no e nasi e ministry or say e India. Na de ye yani say instead of obe fresh assignment no ahun de akoso no onam ena nkrofo na omo pay light of ejuma unso obi wo ho a so unso obi aye ejuma onhwe value na ya create no sika nkrofo bebe no omo ko hwe light wave sika na ya man say hey
eno na opage
menya sika we a mini beji entu instead of obe hwe ejuma light wave ye no nkrofo na ode bi omo so omo pay light wave ejuma no omo bi ena omo asoma so omo ko hwe say light wave ejuma na e ko sen na oni bi esre menya text message be from Obia oye ejuma one of the health facilities osi yesuma auditors no buy no obu chom say light wave no ye ejuma pa na ngofo no bofu say nya enu mo nkasa enti ni padu sending message say the people were saying that they were sent to come and find fault with the light wave system
ayo ya be bo Ghana
there were medical soups omu sending message say so omu catch nkofo no say ade no ebu ejuma pa na omu buefu enti from the word go no aban where na adwin say or ji ejuma no afi light wave enti kwan bi obefa so obe so say waji ejuma no obe fa na enye osire say o pese on network the whole Ghana tio make asem kese what you are close to $73 million aka 20 BB na wa ko see 100 million no ama na what me demand from the person e sheni kiti na kokote yeso say why Ghana nyina 23 na aka no enye no na ehia o see why ready tio akando akọ engage a new vendor say why ready to pay half of the contract sum to this new vendor now onim the essay
na old contract no scanner aka no
na me ba onim the essay new vendor no enye say ejuma na aka na wa be ye o or sabe ye he is coming to redo the light wave ahead no excuse me say sa 450 light wave ahead no information no light wave only and ye suma new vendor we na wa sa ko sha ase foforo
na ne aska aka no omuntua na onfa wi ejuma no
na waka asem no nyina na de yesire nso say omo ye good say na wo minister no omo atimi atoma wa waje tum no ade na won suma mo say health centers na aka no omo nko no mo ko ejuma na yehwe na onim de yesire minister ye bibia ma me ho agiro mi osi wa create the narrative say light wave no ye foreign owned no ono the Ghana owned abati o na ye free Ghana de no is a light wave health minister osi Ghana health information na onim bibia me reveal ha a private vendor bi and I provide that service company
minister
yes
private vendor
private vendor no wo company name company odi instead of obebo mo di ama ya so mo no mo ye no wa create impression say Ghana as if IT officers. It's a lie. So this is a private company and I also presentation
private company indeed is saying
nana me as a matter of principle me a journalist and me free her member information
okay
now I come website
me
as a matter me person be all come reference me do mo asem but I'm giving you 100% information on authority say when you hear Ghana Health Information Management Systems you will be deceived to think that IT officers from Ghana Health Service and Ministry but it is a private vendor Akando Ako engage and guess what they will submit invoices now you are two almost just like Lightwave was being paid. So the minister has succeeded in moving money that will be used to pay Lightwave to give to this private vendor.
So what happens to Ejuma na Akano?
In fact,
Obi
say Akano say, enti Ejuma Lightwave aye nyina no, omo data no benya. Oni do kan ye. Tinti wan kasa do ma akotenasi o. Osi eya because Lightwave share nkrofo or the data no ma tie o or the ma national health insurance. Say no omo dey sure omo claim cinema.
Yeah.
Or the new company wey call health insurance no more go use the claim submitted no and they are rebuilding the data when the data is already supposed and city is already city with us na onim the area just obi a who call hospital I want use health insurance no o data na eden atonsium and you see the comments say or you obi a on tie futuo or you obi a on follow due process because if contract we could see 100 no na year the omu nyina Ghana there. In fact, as at the time I was leaving the ministry, everything that Lightwave does is under our instruction.
Right. As former health minister, implications, you know, some real Lightwave for your cancel contract. And I yes,
implications in say hospitals baby one sure I be call back to folder and manual. The Jamaicans and say company we no on digitizing one region crowd Canada. In fact, remember information make it say company we hospitals 3B1 crime. And why or more digitization. Hospitals 3 ways they don't talk to each other. They say Lightwave the Ghana and United Unkasa. Just free one hospital or more digitized now was on kita folder.
Connectivity.
Yes. No, be minister say enti we amuba shasi ejuma iwe. Uti omu be use 1 week. And they are rolling out all the hospitals. Any new hospitals so they are Lightwave ahead. You are not going to start all over. And obi say enti have they done it before? What they are doing is it a pilot? Or see, they are starting, it's like a pilot. I feel no more a pilot.
Yes, yeah, but queue
Ghana
hospitals.
Yes, it will lead to queuing. Then the most important part is doctors are now going to lose data. Because most doctors, you know, Sebi, Niama, Unconform, show mu patterns, and then I
patient information.
Yes, and I
doctors move.
Oh, yes. Health workers will
then how do you treat
it
patient?
It will affect service delivery. Number 3, the annual shikra was going to say, you have a times 2. There's going to be serious financial loss to this country. They think America say, Sikana ever to a company where Okoe chassis from Kofanoche ni G. Yeah, yes, I do Nana. Uti America say, and yes, Sikana ever Juma Fufro. A Juma 450 hospitals now, Lightwave ahead of honorable account a private vendor. I want to do in Ghana or the DCVA. Now on sound ko chassis free G. Amusa ko Cape Coast Teaching Hospital. Adia ya tiaka. Na oni bi oka yesre. O si enye so mo ko to computer fufuro. Lightwave computers na wa to no. Lightwave servers na wa to no. Lightwave niama na wa hihye no. Enu so na new vendor no ba be use. In effect, no.
So what difference?
In effect, software pen or diba. Now you are training. Lightwave are training over 150,000 IT officers and health workers across Ghana who are managing the system.
As former health minister, the interest by then.
Nana, and you say me and America. Ebina was what America. Where a pure issue of obi awaba officer. Onusu per se on your opportunity or bepe or the nipa beba sebi nkomo bi wo wa onfa numbo asa
onusu per se nkrofo
na bibi sebi so onu na ide adwuma ma omo a de we chiri de enye mi na meka ono beka na enye saa adenti na obi a hospital bia ni Ghana wa complain about the Lightwave system G Kofanoche Tamale obi a no Lightwave dey use district hospital bia oni mo Ghana or use Lightwave. Now what is the doctors are afraid I say Munja sister we use.
Debbie.
Enti akando kaso there is a national emergency. Enti or you 4 weeks. There's no emergency. He has created his own emergency so that procurement can happen. I'm saying it.
That means that to asekura no a sa Lightwave we atwe omo ho a mita kando de ama private person vendor say wo me continue no wo mi adwuma no kore be wi akire no ahwe ya cash and carry system. And you bet me
oh no
because information be no
yes
machine be no be validate national insurance card
the entire hospitals ni can say to asikana omuntimi verify say antimi an use computer na nkyere say wo insurance ye adwuma hospital no show we are ontimi infa records in insurance omuntua enti na hospital say masa me machine ye adwuma nti mamisika me pese me wo akiri o kina be ba ne say na on insurance. That's anything na SRTC no. And number 2, hospitals no starting lose scale because integration they connect you to banks no na enye adwuma. Because na additional service I like to do more. Enti all this no one share hospitals be book twice. Say account or dia bay ebe mu a. And then they want share was so pay another software na ain't connect you to their banks. Lightwave was doing all. Lightwave year bank, insurance, Lightwave year billing. Lightwave, in fact, at a point, Lightwave was even helping Ghana to collect information data on what is happening.
The same cost.
The same cost. Enti we the sitting in no sebi minister we approach. Say me mfa kasa. Look, the only time I can invite Lightwave so do kasa no. O say why audit no show mo. O me pay ya. And I'm going to say audit now why no? Why you audit on us? my draft report no
okay
na yen respond akona so mfa mo na wa forward am attorney general o forward adi ma attorney general for opinion be do na wanya vendor dada enti ni actions na kire wo say bofo fe no premeditated dia wa fun wa dream say ejuma we oji edi ama obi fufuro na onim dey esere mu ye journalist start asking questions process be na kind of court through the ejuma we ma vendor we
if a competitive bidding
no maybe say no there is I can speak on authority say there is no document I call PPA asking for this vendor to be approached, so there is no process I engage. Akano is trying to hide under national emergency. There is no emergency. He has created it himself. And for journalists, the assignment I'm giving you is this vendor account on the Ejumane, you have to go and find out.
Right, I say Dr. Bernard Okoe, Boye, former health minister. Nipa dim try ya ya ade ano kreda ho phone udi agro kro be mo say break phones ni na do phone no bo hon de o be mo say phones ni nyina I know
oh she health ejuma kase wo yi ye wo hospitals o mo hia say minister wo do attention be ko abo mo anya sabi e bia infrastructure kakra ye wo facilities health workers o mo per motivation me minister me ti bi ko sa ko do elubo border me kai nurses hu me say doctor say wa ba pe no there are a lot of things are minister for health ubetimi ayama yakọ enim na u time amu aban mu ansa na MPP ba no na hospitals use paper what be 2450 instead of ubet free omu a eyi ejuma no abiso mu say na ekoso no omu bisa o meeting na o si meeting si na u so ya so wa ko audit na minister ben na oye auditor all ma de wa na audit no hwem o si would letter ma attorney general who try advice before advice baba no obi a o si oye ejuma enye ejuma fufo so no koye di obi aye dada no o se no an koye. What kind of joke is that? Now who kasa o si who inherit a mess who purchase a mini ejuma menu na a mess me wa who nanti ono sebi e obuo ni faye na me de ma wo ye ka health systems na ye ka about health management sebi o wa ja to me say sebi na who do rice
Daniel will prove it.
Enu crowd dem nka wa ja to me say sebi wo si we farmer. What I say? By obuni ni na edi ma wo. Na me di obuo ma wo no. Who co president wo say who inherit mess. Na one person there will be a recurrent of the mess. What do you mean by that? Meanwhile here you are. You have engaged a private vendor when you have not gone through any process. I found out later obe advertise the bid. Unye bid no. How did you get this guy? You had this guy long time. Now in the history, Papa no ye ejuma no company no. They be no mo na ministry so mo polite to ejuma. They no mo dey sell light we say, oh, in Pelifonu bi no omo ti abroche.
That means I wouldn't say company.
Oh, na miss you. Omo ye nkrofo mo pay ejuma na che. Ena papa we aka no buy ena wakotom. Na the history ni say the fact that light wave dey ni ye ejuma o Ghana, obi akọ hospital, Lekma, Central, Reach, bibia Tamaje na obi akọ Smoto. Eni nkyere say we mu no can do that. Adi ayaya yatima chese yejuma afeda wo si ukwa shasi we bi ayaya dada na sebi o yesa onim di wonifa.
Right, Dr. Beja, but answer Beja, no say 8:30 Beja, 8:30 Pepe Beja, what aroma. Now what me man no baby for. But there were other health issues as agenda 111. I mean found ko brand people buying a be free kunya so no na stages be na ye dru do say na yetimi awie. And a young one say health minister by NDC ban by health minister Mita Kando one can be amfa agenda 1111
nana yamin shaw say doctor medimi nua embebi no bia for me civil society group bia yefe no Ghana Amalgam for Development.
Okay.
Aye de ni say bibia e dey input over break Ghana for no ye be kan ho asem. Enti me ye press conference on on health infrastructure in Ghana.
Okay.
And I make kasa about agenda 11. Nana at that health press conference no point back what me yes strongly to Ghana for say Nana Addo Akufo-Addo MPP abaye no COVID baye na ehun say nye de bia na obi betimi afri techi say Okoe hospital e wala badi ena nye de bia na obi betimi afri e bia garu say Okoe hospital Zebila say district bia say munya hospital so obi uchi na Professor say primary health there was say infant gene kwande wo ho
yeah
na ye assessment na ehun say Ghana yɛ waba 88 districts a wɔn ni fit for purpose districts is it fit for purpose a ebi mu ebi koraa no wobɛkɔ na yɛ 2-bedroom house ɛna sɛ bi yɛ di bed ɛne sika atum sɛ yɛ hospital enti yɛyɛ assessment yɛbɛhu sɛ Ghana ha nyinaa no yɛyɛ about 88 ɛna 6 new regions no so yɛka sɛ yɛ di hospital yɛbɛsi regional hospital ama wɔn na ɔde ne nyinaa ka wɔn ɛbɛyɛ 111 health facility ɛna yɛyɛ fɛ no agena 111 na project no hyɛ ase no adan yɛ yɛn sɛ out of the 100 in fact echekwa bɛyɛ agena 114 yɛde Karaga district bɛka 111 no ɛna yɛdi I think Nkranza some 3 communities bɛka yɛ 114 but yɛhyɛ ase no na ɛyɛ 100 sites ɛna yɛ active kyerɛ sɛ wokɔ wɔ kyerɛ sɛ adwuma yɛ dɛn ɛkɔ so na nyame adom time a Akufo-Addo aban MPP aban ba free so no na out of the 100 sites no there were 30 sites baku 30 a adwuma na on across 70%. Now the time me press conference ni say 70% na across no anka fofi anto ata na MPP na wo so a within 6 months to 1 year no na all those 30 no na anka I completed. Enti me press conference no to remind Ghanaians say we are there anka ya mu dia a happen ba bebi nti na MB na me ka wasem so da ochina bi sa afisa betwem na MB ya mo bi nka se okobo ahere anka wasem na this 30 sites no me body quickly uko a Francia Gomoa Central District agena one no 82%. Uko Drew Barekesi a omo mu tie me from Barekesi o make say 74% e wa Ashanti region. Akim Suedro Birim South omo de no 75%. Nana uko Ewutu Breku a Ewutu Senya Breku Central region 72%. Uko Drew Manso e wa Aseno Manso across district a 71%. Uko Drew Mpoho Western region agena 75%. In Saba Agona East District Central Region 71%. In Suam Chichiwe Omudomoko pa Asin South 77%. Ofuansi Mibra Kojo Opon Krumaho 71%. Na Abomusu for the Memamukuse Omudianu 91%. Abomusu Atipoku Eswajaman Deputy Finance Minister Sabranteno Nikrum 72%. Uko Sege ewa down or Greater Accra 70%. Nana list no goes on and on, but last 3 no there ye commission ye just say ye nana tio.
Netio pa.
Ye commission ye I can say ye be ma director general the next is akom. Enu obo kro ewa Ahanta Western region. E commission by na I kasai akandon fa ho. Ya tupru no mu obi anko mu ye. Uko do trade ewa twuma nkwame ma wa Ashanti region ye commission ye. Ena uko do kokobin ewa for kuma commission. 3 way make say doctor akonya si ho sink insio eba theater machine si ho and this is on fa ho enti me ye press conference say na tie we Akufo-Addo aba MPP aban invested $347 million. When I calculated using a rate of 14 it was about 4.8 billion. This is how much the MPP government paid in certificates ejuma na ayaye
under agenda 111
under agenda 111 4.8 billion. Into the Okoe can say you bet now as of mine I'm 4.8 billion aton siomana and number 2 4.8 billion way and you loan or bronini ma yo na ye a toa MPP are buying brofo friend government of Ghana fund revenues GOG MPP are buying yes wa bon on bon o modi on timi nyehwe no on timi G a toa every minimum assume 4.8 billion. Edit Ghanaian contractors. Now only a general one contractors, consultants, or met me do over 100 companies. Now construction workers, a general one Ghana, over 12,000. And no money not fee. Now you see utu abato bonia. Onya emfaso boni. Say some granted 12,000 now. Ebimuko ye in the big kekeru. Na no money not fee. Omutie miniwo. Omwanya adwezakra enti press conference me kire say me sra by way me kan say sika e be wi nyina on pere but the akọ enim 70 ekọ 30 na me boy no
for so complete
sika so onye even $20 million e be complete mienu bi
okay
na men ko yeti say de say Akufo-Addo ana MPP aban e na e share adwuma bi asia any obi be share that aye excuse adwan okoti omo a ena agena ho na sika bia ni ho nana enye bibia ye be ye wo abrabo mu ena obro ne mema sika I fe the loan MPP ne Akufo Addo a kire se ye we biti sa agena ho ye betimi ya ye sika aye
internally generated
na dia wo betu no gi to etu 4.8 billion ade na wo keke mu wo si wa ben chain no wa ben chain nana ene MPP no e ba ne sei ena ono de eto aye ena ye hia wa o si sika ni ho ye mpesa akasa na tie
okay
edwumaden ena ede bu man papa na mo yiye no ne MPP na mo yiye no na nya akwadro ye edwumaden enti na districts na ma bo no omo abi mo mo ko tu ma ban we a obae no me so so omo nya adwen sakra de ba na ye wan ka by now anka mo nyina anka jame adom na onim bibi. One of the things that motivating me, mommy, yeah, press conference, and he say, a hospital, and yet only a place I share omomoyari. People forget. You will be a friend economic pool. You are debi udi ko ebia. Etimima omo abrabo sisa.
Yeah.
Etimima ejuma ebaho. Etimima enibie baho. Etimi sisa obi abrabo. Hospitals ajana wan bebrenu. Ye shada ma eko kroni echi. Ye shada fa krona e dia konche kakra.
Sana be best pandi krono.
Exactly. Enti health workers agena 30 we amikai say omutimi wi a last account say na ye was 75,000 health workers omuni ejuma sebi obi o health worker o ejuma ojom a hospital obey omutimi complete 30 where it can absorb about 12 to 15,000 health workers. You have the opportunity to create job for the youth and I wait 12,000 way health workers o na I feel na mabeka truck drivers ni taxi drivers o may station or hospital name afa na mabeka omo de omo sika me say anka me ko abomosu a mepe 2-bedroom house bi asi wo hospital ni chain doctor bi be renti brofo frɛ no economic activity
omo mbe tonton nuane
na bebre enti mitina na me ka say mo ya ba ya mo ka say mo be ye one job 3 shifts 3 people 24-hour economy say one shift kra say oji won crofo sem enti na ye ka agena one Ashanti regional minister was reported on some media. So my we 3 bi Ashanti matima be kyeremu say sa 3 no ka nyina en ka nyina wa hospitals a MPP aban see through Vamed oka enu bi na yesi wo drobonso e na suamini na ma no omo odo na ye ya wi ano no omo na omo di nurses ni ma ko hyemu obekasa yesi o say general one on name difference enya general one na create a false impression say aban we did sa aso general one. I can speak on authority as we talk now. Not even one general hospital. And omudi akonya bako abeno ananes bako akomo. Omo jani nyina won rem. De area so matum and I nyina ye wo.
Right, when I say yam fra agenda 111 ho obrani deeper po. Ne ko tam ne medi so pepe doctor. O tam ne medi so pepe. E dia ma. Ye backlog na wo ho. Brand PP aban e be fra akonya so asat December 7 2024 ye beto aba na nurses for do say ne yetimi omunya adwuma yetimi ama omadwuma do say ne timi clear omo ansa na MPP aban e fra kunya
na make it a breakdown.
Okay,
na osha MPP aban within the 8 years na your office no ye G Nkrofo close to 185,000 health workers.
185,000.
Now the AS3 ni say me brother Akando obeka say na ye ma clearance for I think or see I about 13,000 12,000 health workers nurses now so ye G65 NIKB unim dey see here. So normally what happens in say let's say as we speak nurses omo ye adwuma say ya ji omo Ghana e bi omo wie school 2021 e chere say we ba be nurses for next year and this year be fa new we be 2022 batch before our ministry be ma clearance no ministry no checking with nurses and midwifery council say that year no how many nurses finish the program and the midwifery nurses and midwifery council can say 13,000 nurses finish until ma clearance for 10,000 because ugo yi kofi buy free mo and ugo yi so every year no the clearance honorable Kando on him the clearance matches the number ye school that year. Now say Ministry of Finance mark clearance obeka say mark clearance to cover that number of nurses but guess what 30,000 ebi mo all the money nursing no omo akọ into journalism ebi mo want to kwa abrochi emewu enti woman clearance you have na Ministry of Health ye the information all the agencies say mo put the information of this nurses say they can now go to they should, first of all they should log into the system to show that they are willing to work. Yeah. So consistent I feel almost physically to the regions no record it takes some time. And they can give the clearance let's say August of let's say this year. But time go through the system maybe by yes. And it said by December now out of 12,000 7,000 alcohol system next year out 5,000 I can and just say clearance now we use a technical term that every clearance expires for the year. But in reality, no, it normally is a rollover. Okay. Because it's a government is a continuum. Yeah. And it would normally because finance and clearance no, and a finance and any controller no, controller will give finance information. Say 12,000 now clearance no, and a 7 abem. And or yeah budget item for next year minimum expenditure line ever cover the 5,000. Unim do mo ye no. Honorable Akando. Omo ba no. NDC aban kita adwin bi say obi a ye fa no MPP abreso no o ye MPP ni MPP aban kita adwin bi say obi a ye fa no adwuma wo MPP aban MPP breso no o ye MPP ni enti omo ba ye no omo sheda ko hide under the excuse say how do you call it clearance letter expire for the year na issue no and the NDC government refused to put the expenditure line of the how do you call it engagement or employment of the nurses. Okay. They refused to put in a 2025 budget, giving the excuse clearance now expire. If the MPP had remained in power, that 5,000 would have gotten on board just as the 7,000 got earlier. Now only nurses no started charging core ministry no. Teachers started charging core on the reasons. And omo free cabinet meeting emergency. Unim the eka tell about 240. Omo ye the environment. Say why ye juma wo government sector da. Say ye environment. Che say sika bia ye dey to o say edi koye bibi no. Ye redirect sika no. Omo they ended up omo ye environment. Omo redirect cabinet e redirect sika and komo koye bibi fufro and omo dey be ye expenditure line to pay teachers and health workers. The actual one say na enye the case in this cow. Na enye the case say NDC about prioritizing the health workers employment. Okay. And now and community sa sika no kwa ya de fufuro. Nurses ni teachers so won kon no ansa na omo frɛ omo finance minister and a cabinet. NDC cabinet share finance minister no share ono ba 240 kiti say ora ye environment say sika na da order da akodi area bibi fufo no yifri ho na fa betu health workers enti say honorable Akando and a one subsidy so be convince ato forcing so on for expenditure line entuo say na ya bresu ye no a ene me manu due owedwuma ye na instead of sebi obeko rounder or yet say the ye dwuma ho nyina obetu ye no sebi ye nim ye left or right no ebe boa no if otie futuo engage the health minister and other key members of cabinet. Now, nyama ekoso no enjoy. Now, one recommendation mechanism Honorable Julius Deborah, all ministers work under the chief of staff. I'll make a special appeal to Julius Deborah, Honorable Chief of Staff. The Honorable Akando it can bring issues of either judgment debts or we can lose some value and money in the process. Honorable Julius Deborah should help to get a third party mediation expert. Now, all for multinationals, because in all these things, a kind of story, and a party in the contract cannot be telling us what is happening with the dispute. Julius Deborah should save the situation because a kind of posture need the oil need one shot. Right, quickly let's touch on Mahama case. The national health insurance. The American say Mahama case, where they throw to her. My Madrid say 1 year of this administration, you better take a good look at the health sector. Okay. Now, sad discussion will give Mahama care enough and appropriate time. enti fufuo no mennom nkwan no emfi fufuo no ma ye ma just me wo ama
Dr. Benasi. Dr. Bernardo Okoe, your former health minister, on our test, AD and Komo and then.
Thank you for watching. Like, comment, share, and subscribe.